I'm going to do is wash my hands. I've gathered all of my supplies. I'm going to focus my assessments around the nursing diagnosis that is presented, which is pain in the abdominal region. And then I am also going to give my patient clear instructions. So I'm going into my patient's room. I put on any PPE if needed. Pulling the curtain for privacy. Can I please get your full name and date of birth?
Brian Neary, 6/28/99.
Okay. And I'm just looking at his wristband, checking that in with the computer. My name is Maddie. I'm a student nurse. I'll be taking care of you today. So the first things that I would do is get his vitals. The normal temperature in a healthy adult is 36.7 degrees Celsius to 37 degrees Celsius and 97.7 degrees Fahrenheit to 98.6 degrees Fahrenheit. The normal blood pressure is 90 to 120 for the systolic, and diastolic is 60 to 80. Normal heartbeat should be 60 to 100 beats per minute. Oxygen saturation should be above 93%, and the normal respiration count is 12 to 20 respirations. And the next thing I'm going to do is do a comprehensive pain assessment. This is where you focus in to one area. So can you tell me, do you have any pain today?
Yes.
And where is it located?
Abdominal region.
Okay, and can you tell me the characteristics of it?
It burns.
Okay.
Yeah.
And when was the onset? When did it happen?
About a week ago.
Okay. And then is there any aggravating factors?
When I move around.
And how about relieving?
Resting.
Okay. And on a scale of 1 to 10, how would you rate your pain?
2.
A 2 out of 10. Okay.
Mm-hmm.
So this is something I like to ask all my patients. Do you feel safe in your home?
Mm-hmm.
Okay. I would ask my patient this only if he was alone in the room, of course, and which he is the only person in the room. And so you're not in any abusive relationships. No one's bullying you.
Nope.
Okay. So after doing that, I'm going to do a skin assessment. So I'm looking at his skin, noting the capillary refill. It's under 3 seconds. Looking at skin turgor. This determines dehydration, and you can also look under the clavicle because this doesn't get much sun. And then I'm also looking for the texture. It's nice and smooth. And I'm also going to look at the palms, looking at the temperature, the texture, and if there's any abrasions over the skin. So now that I've done that, I'm going to look at the head and the face. His head sits symmetrically on his body, and his face, I'll have you smile and blow up your cheeks for me. Okay, and this is testing cranial nerve 7. And I'm noting his hair, it's shiny, it's brown, it's distributed equally around everything. And I'm now just going to go ahead and put on my gloves. Okay. And I'm palpating around his head lightly, looking for any invasions, like lice, and I'm palpating for any tenderness. And you especially want to look in the back of the head because this is where they would most likely hide out. So now I'm just looking at the external eye. I'm noting that the pupils are round inside the irises. The sclera is white. They're moist. They're not dry. I'm looking at his eyelids. I'm looking at his eyelashes and his eyebrows. Can you raise your eyebrows for me? And the symmetric shape. And now I'm going to do the cardinal field of gaze test. So this is noting constriction of the pupils. Well, no, it's looking to see if you can follow the fingers smoothly and that they're not sluggish. So we're going to go ahead and do that. So okay, So I would actually like to redo that. So I would go, on the second half, I would go up diagonally to the side and down. And I'm noting any sluggishness in the eyes and to see if you can follow my fingers smoothly. And this tests ocular nerves 3, 4, and 6, which is the ocular motor, trochlear, and the abducens. So now that I've done that, I'm just going to see how reactive his pupils are to light. And so I'm noting constriction on this as well. And his pupils constricted. They constricted. And I'm going to come in from this side and I'm going to look at his right eye to make sure that it's responsive when I shine it into his left eye. Yep, and it constricts. And this one also constricts. So, and now I'm going to do the distance test. So I'm going to have you look into the corner of that. We want distance. We want the pupils to dilate. And then I'm going to go up close and we want them to constrict. This is testing cranial nerve number 3, the ocular motor. So I'll have you look up into the corner and his pupils dilate. And then I'm going to have you look here and they constrict. Okay, so now that I've done the distance test, I'm going to go ahead and I'm going to palpate around the ears. I'm palpating the mastoid process here. And I'm looking for any abrasion behind the ears. I'm assuming that his auditory cranial nerve 8 is grossly intact because he's answering my questions and he can hear me. So now I'm going to go ahead and look at his sinuses. I'm looking at any inflammation or any pressure here. I'm going to palpate the frontal sinuses. And then we're going to do the maxillary for any pressure. And is there any pressure there? Okay, so now that I have done the sinuses, I'm going to move on to the mouth and the throat. So I'm going to put on my gloves for this. Okay, so I'm looking at his lips. They're nice and pink. I'm going to look at his mouth. I'm looking at his tongue. It's pink. I'm looking at his teeth. He doesn't have any teeth missing. His tonsils are not present because he must have had them out. I'm looking at his uvula to make sure it's symmetrical. I'm looking at his mucosa to make sure it's not dry in there. So can you go ahead and stick your tongue out and say, ah? And his uvula reacts and it goes up when he said, ah. And then he stuck his tongue out. I'm noting the symmetry. When he sticks his tongue out, this is testing cranial nerve number 11. And his tongue is symmetrical. And I'm going to have you swallow for me. Do you have any problems swallowing? Nope. And this is testing cranial nerve number 9 and 10, and this is the vagus and the glossopharyngeal. Yeah. And so now that I have looked at his mouth, I'm going to move on down the body to his neck. I'm looking for any lumps or anything inflamed, and I'm going to palpate the carotid artery. I'm looking for the pulse here. So I inspected for any lumps or anything inflamed. I think I might have said that. But then I'm palpating for the carotid pulse. Okay, I'm doing this one at a time, and it's a 2+ bilaterally. So now I'm going to move up to the upper extremities, and I'm going to move up to the upper extremities, and I'm going to test your range of motion. So I'll have you put your arms out, and then you're going to put them above your head, and then we're going to go to the side, and you're going to put them up. Okay, you're going to put your hands out in front of you, and you're going to close your eyes, and there's no drift. If there was, then one of his hands would have went down. So I'm going to test your strength bilaterally, 5+. And then I'll have you put your hands out again, and then I'm testing your strength. And then you're going to push down. Okay. So I'm going to have you sit on the edge of the bed now. I'm looking at his AP ratio, and it's 1 to 2. This is normal. And so this is also where I would do a breast examination. So, I'll do the breast examination after I do the lungs. So I'm inspecting the muscles on his shoulders, the muscles on his scapula, and I am going to have you take a deep breath in and out. I'm noting that his chest rises and falls symmetrically, and that his spinous process is straight. So I'm going to osculate in 6 different areas. So I'll have you go ahead and take a deep breath in through the mouth. Noting any crackling. This is between the scapula now. And then in the bases of the lungs. And they are clear. He has clear lung sounds bilaterally. So I'll have you come and sit over here now, so they can see what we're doing. Yeah. So I'm inspecting the anterior portion of the chest, making sure that it rises and falls symmetrically. So I'll have you take a deep breath in. Okay. And his chest rises and falls symmetrically. And now I'm just going to listen to 8 different spots. On the anterior chest. And then I'm going to do the lateral side, so I'll have you lift up your arm. Okay, and then this side. Okay, and so now this is where I would do a breast exam. I wanted to wait until I was closer to the camera so you guys could see what I was doing. So I am going to, if I was on a woman, or if this was a woman, I would, here, we need to figure something else out here. Can you like scoot over that way? Yeah. Okay, there we go. So, if this were a woman, I would be, well, and a man too, but more so this is for women. I'm looking at the color of the breast, making sure that they're symmetrical, noting any inverted nipples. I'm palpating the chest to see if it's tender, and then I'm also palpating the ribs to see if it's tender. And then I'm noting any nipple discharge. I'm not sure if I said that, but And then I'm going to educate her on how to do a self-examination. And you want to do this at least once a month. And it's 7 to 10 days after the onset of your period. And this helps so your breasts aren't as tender. And so you're going to stand in front of the mirror and you're noting to see if they're symmetrical, looking for any puckering or tugging. And it's normal to have one breast larger than the other. And then you're going to bend over and you're looking to see symmetrical shape as well. And then you're going to want to put your hand behind your head and you're going to lay in bed. And you might want to prop yourself up with a pillow or a towel, and you're palpating around the nipple all the way out, and you're looking for any thickness here. So, yeah, I'm going to now auscultate the heart. So, yes. So in the second intercostal space, this is the, in the second intercostal space, this is the aortic on the right-hand side. And then we have the second intercostal space over on the left-hand side. This is the pulmonic. We go down to the third. This is Erb's point. Fourth, this is tricuspid. And then the fifth, this is the mitral. I'm listening for an apical heartbeat. And this is the apex of the heart. I'm going to listen here for 1 minute. I'm going to redo that now with the bell of my stethoscope. On the right-hand side, this is the aortic. And then over on the left-hand side, second intercostal, this is the pulmonic. Going down into the third intercostal space, this is the Erb's point. And then in the fourth, this is tricuspid. We're then going to the fifth intercostal space. This is the mitral. I'm listening for an apical heartbeat. This is the apex of the heart. I'd listen here for 1 minute. I'm noting any murmurs or abnormalities that I might hear, which I did not hear any. So, yes. So now we're going to go back and lay in bed. Okay. And I'm going to have you lay flat for the abdominal exam. Oh, I'll take this pillow too. Okay, there we go. So I'm first inspecting the stomach, making sure that it's not distended, nothing's inflamed. And then I'm going to go ahead and auscultate over the 4 quadrants, starting in the right hand, first quadrant on the bottom. I'm listening here for bowel sounds. And then on the left-hand side, I'm in the 3rd quadrant now. And then the left lower hand side, this is the 4th quadrant. Okay, and he has reactive bowel sounds, normal bowel sounds. So now I'm going to go ahead and percuss in each of the quadrants, starting in the right hand lower. This is the 1st quadrant. Okay, and now I'm going to go ahead and palpate lightly, and I'm watching my patient's face for any grimacing. I'm feeling to see if anything is inflamed here. Is there any pain? Okay, I'm going to do a bit more moderate now. Any pain?
No, tickles.
I'm doing this in the 4 quadrants. Okay, so now that I have finished the abdominal assessment, I'm going to go ahead and find the femoral pulses. And, well, no. Okay, I'm going to first find the popliteal pulses. No, I'm not. I'm not going to do that. I'm finding the femoral. Yeah, okay. I'm finding the femoral pulses. I am palpating for them. Okay? And then the popliteal behind the legs, those are a 2+. Popliteal behind the legs. That's 2+ bilaterally. And then I'm feeling the tibial.
Can't see it.
That's okay. Oh, can you see the feet?
No.
Okay.
Yeah, you can.
The tibial pulse, which would be right here. Feeling for that. Bilaterally. And that's a 2+ pulse bilaterally. And then I'm feeling for the dorsalis. And that is a 2+ bilaterally. So I'm going to wash my hands after that, even though I'm going back down to the lower extremities anyways. So I'll have you uncross your legs for me. I'm noting the color, and I'm noting any abrasions on his skin, any drainage. I'm inspecting the heels of his feet to make sure that there's no abrasion, because this is a common area, which is not. Everything is smooth and intact. I'm then gonna do range of motion. So, okay. And then put your leg out to the side. And then that side. Okay, great. And I'm gonna assess the strength. So you're gonna push on my hands like a pedal, okay? And then you're gonna push back, flexing them, okay. And then I'm also noting the capillary refill, and his toes is less than 3 seconds long. And then I'm also going to do the Babinski, and it's just an upside down J, and it was negative because usually you only see this in infants. So I'm now going to do, I'm going to check for edema in his legs. Can you see me?
Yeah. No, not really.
Okay.
No, yeah.
So,
move over.
Hopefully that doesn't fall, right? Okay. So I'm assessing for edema with the 2-hand method. Okay. My patient doesn't have any edema, but if he did, 1 millimeters will be 2+, 2 millimeters would be 4+, 3 millimeters would be 6+, and 4 millimeters would be 8+. So, I'm gonna just do hand hygiene one more time. Do you have any questions for me? I am gonna put my patient down in the lowest position. He's gonna have his collet in hand. All the side rails will be up, and that completes my head to toe assessment.